Hello everybody, this is Dr. Omid, and in this video I'm going to talk about the liver and pancreas and the pathway of the bile, and also some general information about the peritoneal cavity. Hopefully it will be useful for you. So liver is the largest internal organ of the body. The liver has several functions. The most important function, it's playing role in the metabolic function. It means, for example, production of albumin, globulin, glycogen. Also, they are playing role for the production of the coagulation factor. It has very important function for detoxification. And also it has a very important function for production of the bile. In embryonic life, the liver is take part for the production of the red blood cell and the blood. The weight of the liver approximately normal level is 1.5 kilogram. The transverse length of the liver is approximately 25 centimeter. The color of the normal liver is approximately the brown and the reddish color, and the liver is very fragile. So in the traumatology, if you have a trauma to the liver, it can lead to the bleeding to the peritoneal cavity, which can be danger. So the liver topographically is located the right lobe of the liver. It's located under the thoracic cage, and normally is not extend beyond the costal margin. So the right lobe of the liver is covered by the costal cage and costal cartilage. Then the left lobe it's continue and is emerged to the epigastrium region or epigastric region, and it's connected. And it can be present by in topographic by the line that is connecting the cartilage of the right 9th rib with the cartilage of the left 8th rib. So this is the position of the liver. The liver is localized in the supra-mesocolic part of the peritoneal cavity, and in this case, the blood supply of the liver is from the celiac trunk, which is the unpaired branch of the abdominal aorta. The liver, that in this picture that you are looking at the liver, you are looking at the anterior view of this picture, and here in this surface we have the diaphragmatic surface. So generally the liver has two main surfaces. One surface which is called diaphragmatic surface is toward the diaphragm, and the other surface which is the other side, and I'm going to discuss, is the visceral surface of the liver. So the diaphragmatic surface is the upper convex surface. And in this diaphragmatic surface, sometimes you can see some impression of the heart, which is called cardiac impression. Sometimes it's visible. Regarding to this picture, in anterior view of the liver, you can see the passage of this ligament, which is called the falciform ligament. This is the sagittally oriented ligament, which is as a matter of fact, is the duplication of the peritoneum, and it's connecting the liver toward the anterior side and a little bit superior side to the layer of the peritoneum toward the diaphragm, and also the mainly is toward the anterior abdominal wall. So the sagittally directed falciform ligament, which is seen here in this picture, it's connecting the liver to the anterior abdominal wall. And in this case, what is in the right side that you can see is the right lobe, which is the size is bigger than the left one, and what you can see here is the left lobe of the liver. Another ligament that you can see in this picture here, for example, is the coronary ligament here, and here there are the coronary ligament, and this coronary ligament is the simple one layer of the transitional place between the peritoneum and the serous layer of the liver. That is located in the superior part and posterior part of the liver, and it's going to the margins that the liver is not covered by the peritoneum. It's just a small part of the liver is not covered by the peritoneum and is attached directly to the diaphragm, which is called ara nuda, or bare area of the liver, that I'm going to discuss. So in both sides of this bare area or ara nuda, you have ligamentum coronarium hepatis, or coronary ligament of the liver, and this coronary ligament of the liver by the bare area or ara nuda that I'm going to show, which is not covered by peritoneum, is divided to the right and left coronary ligament. And then this ligament is continue as a triangular ligament, the right triangular ligament here, for example, and the left triangular ligament, which is in the left side. This triangular ligament, it's continue here, and it becoming narrow as a structure which is called appendix fibrosa hepatis. There's a fibrous hepatic appendix which is continue to the connective tissue in the left side, and is attaching to the place of the diaphragm. So this is another structure that you can see in the liver. In the anterior view of the liver, so you can see the fundus of the gallbladder also, which is seen, and then I'm going to discuss that you can find this fundus of the gallbladder at the point of Murphy, that it's the connection of or where the medioclavicular line is meeting with the ninth costal cartilage. So it's the Murphy points, or points of Murphy, which is determining the fundus of the gallbladder. So this is about the diaphragmatic surface. The diaphragmatic surface is continue, and the border between diaphragmatic surface with the visceral surface is called inferior margin of the liver. And we are going to discuss, and we are going to turn the liver to the other side, and we are going to see the visceral surface of the liver, that there are located a lot of structure that we are going to discuss. So here you have the view of the visceral surface of the liver, that we said that anteriorly and downward it's divided by the inferior margin from the diaphragmatic surface. So in the visceral surface, here it's the left lobe, and here it's the right lobe, and between the right lobe and left lobe you can see additionally two functional lobe also is seen here in the visceral surface of the liver. One that is beside to the groove for the inferior vena cava, to the left side, it's the caudate lobe of the liver, and the other lobe, which is here and is left to the fossa for the gallbladder, it's the quadrate lobe of the liver. So in addition of the right lobe and left lobe, you have the caudate lobe and quadrate lobe. The caudate lobe is located beside or to the left side of the groove for the inferior vena cava, which is fixed with the ligament of the inferior vena cava here, and the quadrate lobe is located left to the fossa for the gallbladder, and its name is the quadrate lobe. So the quadrate lobe is approximately located near to this place, which is called porta hepatis, which is very important, and the structure that is located in the porta hepatis in this area, there are three main structures that I already said it, and those structures, they are passing through the hepatoduodenal ligament. So if you open the hepatoduodenal ligament and you dissect it, and you can see three structures inside. The most posterior structure here is the portal vein. Then the anterior side and the right side to the portal vein, it's the common bile duct. And here, anterior side and the left side, it's the proper hepatic artery. So three structure: portal vein in the posterior side, anterior and right side common bile duct, anterior and the left side the proper hepatic artery. Altogether, here is called porta hepatis, which is very important, and there's those three structures, they are passing inside the ligament, which is called hepatoduodenal duodenal ligament. So here it's this. And if you remember, I mentioned that there is an area of the liver. So because the liver is generally called intraperitoneal organ, most of the liver is covered by the peritoneum, except this area, which is directly connected to the diaphragm, and this is the area nuda or bare area of the liver, which is connected directly to the diaphragm and is not covered by the peritoneum. So if I continue to discuss about the visceral surface, you can see the structure which is called ligamentum venosum. This is the ligamentum venosum, which is similarly sagittally it pass, and it's the ligament that it's identical with the anterior side that we said that is a falciform ligament, and this ligamentum venosum is continue inferiorly as ligamentum teres hepatis or round ligament of the liver, which is the connective tissue which is connecting the liver to the umbilicus, and this is this ligament of the teres or round ligament of the liver. It's the remnant of the umbilical vein, and which is in at the life inside the uterus. The intrauterine life. So it's carrying the blood from the placenta to the liver. So this is the ligamentum teres or the round ligament of the liver. So because it's called its visceral surface, so it means that the liver, it has it's lying on some organs, and that's why the organs, it can make in the visceral surface some impression. In the left lobe of the liver, we have impression for the stomach. As we mentioned it in the stomach part, we said that we have the hepatic surface on the anterior right side of the stomach. So, and this is the gastric impression, and sometimes posteriorly you can see the unconstant, the esophageal impression as well in this area. So in the right side we have the colic impression. So this is, as a matter of fact, is the place of the right colic flexure or hepatic colic flexure that is continuous as a transverse column. So that's why they call it colic impression. Then above that, here is the impression for the right kidney and the suprarenal or adrenal gland, the right one. Above that, so this is the impression for that. And near to the porta hepatis and the gallbladder, here there is an impression for the duodenum, which is called duodenal impression. So this is the duodenal impression that I mentioned. This fossa is the fossa that the gallbladder is located. We are going to discuss separately, and this is the quadrate lobe. To recognize, the quadrate lobe is beside the gallbladder, and caudate is beside the inferior vena cava. This quadrate lobe, it's sitting on the pyloric part of the stomach, and also a part of the duodenum. It's projecting on this area. So this is about the visceral surface of the liver. And the ligaments that we mentioned it. So we have the coronary ligament, we have the triangular ligament, we have the ligamentum venosum, and the ligamentum tres, or the round ligament of the liver, and the falciform ligament. And here again you can see the appendix fibrosus of the in the left side superiorly, which is the connective tissue, which is connecting the with the left triangular ligament, and also is connecting with the diaphragm. Regarding the structures of the liver, the histological structure of the liver that, of course, you have to know. It's very important. And generally, the main structure of the liver as the biggest or largest gland in the gastrointestinal tract is the parenchyma, is the hepatic parenchyma. And the main cells that they are forming this parenchyma of the liver is called hepatocytes. Hepatocytes, they are located inside the structure which is called the hepatic lobules or classic hepatic lobules. This is the basic morphological unit of the liver, that you have to know what is the hepatic lobules or the classic hepatic lobules. Hepatic lobules is formed by this structure that is called hexagonic, or its shape is hexagonic shape. It means that it has six-sided hexagonic structure, and the center of this structure, it's located the central vein. This central vein is communicated to the sublobular veins, and from the sublobular veins it's drained to the three hepatic veins, and finally drained to the inferior vena cava. So to understand this morphological unit of the liver, which is the hepatic lobules, you have to know about something about the blood supply of the liver. We have two kinds of the blood supply of the liver. One is functional blood supply of the liver, which is the blood is carrying to the liver by the portal vein, and it's the approximately 80% of the blood supply or blood that is coming inside the liver, and it's carrying the nutritional unwanted material from the blood from unpaired organ of the abdominal cavity to the liver. So the portal vein, and portal vein, when it's entering to the liver, it's divided to the branches that these branches, they are located in the portobiliary space, and they are making the interlobular branches, and these branches, they are open, as you see here. These branches are open to this capillary structure, which is called sinusoid. So the nutrition, when it comes to the liver by the portal vein, it's carried by the branch of the interlobular veins. The blood is going to the inside the sinusoid, and the direction of this blood from the periphery, it goes to the centrally, which is the location of the central vein. So it's called from the peripheral to the central. So another blood supply of the liver is nutritive blood supply of the liver, which is supplied by this artery, which is called proper hepatic artery. These hepatic arteries, they are arising from the celiac trunk, and then are divided as a common hepatic and then proper hepatic, and then this proper hepatic then is giving the branches like when it coming inside to the liver, and it's take part approximately the 20% of the blood supply to the liver, and is carrying the oxygenated blood, so it's carrying the oxygen to these cells, hepatocytes. So by the branches of this proper hepatic artery, which is called interlobular artery, also the blood from the proper hepatic artery, nutritive blood supply of the liver, also it enter to the sinusoid, which is directed to the central vein. So it's the centripetal direction. It means from the periphery it goes to the central part of this hexagonal structure, which is located the central vein. So till now you know that the nutrition, it's carried by the intralobular branches of the portal vein. It's going to the sinusoid, and it's going directly to the center of this hexagon or the hepatic lobules in this direction. The same, the oxygenated blood, it's carrying also by the intralobular artery. It's going to the sinusoid and is entered to the sinusoid and is directed toward the central. So this two, it's the direction from periphery to the centrally. Then parallel at the wall of this sinusoid, you can see some cells that they are called Kupffer cells, and they are playing role as a macrophage. So if there are some bacteria or any unwanted particles that it's existing inside this blood, so it's phagocytosis is happening by these cells, which are called Kupffer cells. Another structure that you can find it, so till now you know that we have the branches of the portal vein, which is the interlobular vein, and the branches of the proper hepatic artery, which is called interlobular artery. It's located in the portobiliary space. So we have another structure that it's not draining inside the sinusoid. Inside the sinusoid is just open the branches of the portal vein and branches of the proper hepatic artery. And beside the sinusoid, there is the arrangement of the hepatocyte. That these hepatocytes there is a space between the sinusoid and hepatocyte, which is called space of the Desce and or Disse, they call it. And the space of Disse is the place that the hepatocytes, they are communicating with the blood inside the sinusoid. So then they can take the nutrition from the portal vein and oxygen from the proper hepatic artery to the hepatocyte, and also they are producing, this hepatocyte are producing some material that they are carrying to the blood inside the sinusoid via the small pores that they are located in the border of the wall of the sinusoid and hepatocytes. The other side of the hepatocytes, they are the place that they are producing the bile. So this bile, it's directed from the centrally, vice versa, toward the peripherally, and it's draining inside the interlobular peripherous duct, interlobular duct or bile duct. It's draining here. So here the direction is from the central to peripherally, and the bile it's draining here to the biliferous duct or the interlobular biliferous duct. So in this case, in the place which is called portobiliary space, you can find tree structure. And this tree structure, you can find it at the corner of each hexagonal part of this hepatic lobule. So here, you always have this tree structure which is called hepatic, or they call it the hepatic trias, or the English terminology is the hepatic triad. It's the place that it's this tree structure it contains. As a matter of fact, it's another fourth structure also is existed, so that's why it must be called tetrad. Because the lymphatic tissue also is located here, so there are four structures, not only the branches of the portal vein, the branches of the proper hepatic artery, and also the bile duct, but also some lymphatic tissue and lymphatic duct also is presented here. But generally it's called portal trias, and they are counted as a tree structure because in that time they didn't see this lymphatic tissue. So this is the main structure that is a basic and simplified structure that I'm discussing. So if you catch three hepatic lobules, and connecting the central vein together, like this is, and this is, and this connection of this central vein together, they all make the portal lobules. And the portal lobules, at the center of the portal lobules, it's the location of the portobiliary space, which is contained of the interlobulary artery, interlobulary vein, and interlobulary biliferous duct. So this is the portal lobules. And another structure that is important and you have to know, it's the acinos that in next picture I'm going to talk. So here you have the picture again. You see that this hexagonal hepatic, the classical hepatic lobules, here they are the place of the central veins. Those are the place and the direction of the hepatocytes. Those are the direction of the sinusoid, and here the direction of the bile duct that they are draining to from the central to the periphery. And here that we said that if we catch the three central vein of the three hexagon of the hepatic structure or hepatic lobules, so if you connect that to them, so you will see that the portal lobules, and in the center of the portal lobules you have this structure which is called the portobiliary space, which is contained of the tree structure, interlobular artery vein, and biliferous duct. So here it's called the portal lobules. And then the last terminology that you have to know, it's the hepatic acinos. Hepatic acinos, it's, as a matter of fact, is the functional unit of the hepatic parenchyme of parenchyme or the liver, parenchyme of the liver. It's connecting the the two central or connecting the central vein of the one hepatic lobules to the other hepatic lobules. So, and the shape, it's the diamond shape, and this is the place that it's supplied by the common interlobular vein from the portal vein, and also interlobular artery. So if you look at it, the place of the central vein and the artery and the vein, they are located in the periphery. So if we divide them to three zones, so the peripheral zone, they are the zones of the high oxygenated, and the middle is the moderate oxygenated, and in the center is the smaller or the poor oxygenated part here. So the same here, the zone 1, it's the rich blood oxygenated, moderate oxygenated, and whenever you are reaching to the central vein, so it's the area of the poor oxygenated. So here it's the diamond shape, which is called hepatic acinos. This is the functional unit of the hepatic parenchyma. So that's a very basic and very quick information about the structure of the liver, that you have to study the details of this structure from your book. So as we mentioned, the bile, which is very important structure for the digestion of the fat, is produced by inside the hepatocytes, and it's released to the space which is located between the hepatocytes. And then these biles, they are, as we mentioned it's the direction is going from the periphery, from the center toward the periphery, and they are draining to the interlobular biliferous duct, and the interlobular biliferous ducts, they are connecting together, and they are making the segmental bile duct, and this segmental bile duct, finally they are connecting together and they make the hepatic duct. The hepatic duct, we have two, and we have the right and we have the left hepatic duct, that they are coming out of the liver, and immediately after the coming out of the liver, they are joining together and they make the common hepatic duct. This common hepatic duct is approximately 3 till 5 centimeter, and the diameter is approximately 5 millimeters. So this common hepatic duct is connected with the duct of the gallbladder, which is called cystic duct, and they form this duct, which is called common bile duct. The common bile duct, or ductus choledochus, it's approximately the length, it's 6 till 9 centimeter, and the diameter is 8 till 9 millimeter. It's so 6 till 9 centimeter, and the diameter is the 8 till 9 millimeter, and it's located inside the hepatoduodenal ligament as a structure of the porta hepatis that we mentioned it, and it's continue behind the head of the pancreas, and it's directed toward the duodenum, the descending part of the duodenum. On the posterior wall you have the longitudinal fold that the common bile duct, it's joining with the hepatic with the pancreatic duct, and at the either it can be alone, like each of them separately, they open to the major duodenal papilla or papilla of the Vater at the descending part of the duodenum that we already mentioned it, and at the opening of them, the bile duct, the common bile duct and hepatic duct and the pancreatic duct, they are a sphincter, and this sphincter it can be connecting together, and they make the common sphincter as a sphincter of the OD, and it's regulating the release of the bile duct and pancreatic duct to the duodenum. So once more, the pathway inside the pathway of the bile inside the liver is called intrahepatic pathway. That it's the bile is produced by the hepatocytes and is released to the space between the hepatocytes. They are going from the center to periphery, vice versa of the blood from the portal vein and the proper hepatic duct, that they were going from the periphery to the central vein, and then it goes to the interlobulary biliferous duct, and interlobulary biliferous duct that they are located inside the portohepatic portobiliary space. They are joining together and they make the segmental bile duct, and then the segmental bile duct, they form these two duct, which is the hepatic duct, the right hepatic duct and left hepatic duct, that they are coming out of the liver. And then they are joining together and they make the common hepatic duct. The common hepatic duct is joining with the duct of the gallbladder, which is called cystic duct, is the spiral shape that we are going to discuss, and they form the ductus choledochus, or common bile duct, that is open to the major duodenal papilla. And here at the junction, here we have the ampulla at the junction of the common bile duct and hepatic and the pancreatic duct. It's the hepatopancreatic ampulla, and they make the sphincter of the hepatoduodenal ampulla, that is the OD sphincter that we already we mentioned. Regarding the gallbladder, the gallbladder is approximately, the length is 7 till 10 centimeters, variable. As we mentioned it, the capacity, it's around 50 milliliter. As we mentioned it, the position of the fundus of the gallbladder is located at the point where the medioclavicular line at the right side is meeting the cartilage of the right ninth rib, the point of the Murphy. It's the place that you can determine the position of the fundus of the gallbladder. The gallbladder normally, in the normal condition, cannot be palpable unless that it by the disease is becoming enlarged. So as we mentioned, so here is the fundus, the largest part, then continue as a body or corpus, and this body and the corpus is continue with the neck of the gallbladder. So the transitional part between the body and the neck is called infundibulum, and from the neck it's starting the duct, which is called cystic duct. The cystic duct is approximately 2 till 5 centimeter, and the diameter is 3 till 5 millimeter. Inside the duct there are some spiral fold, they call plica spiralis, or spiral fold, that the function is that is it's allowing the passage of the duct to the both sides. So from here to the gallbladder and from gallbladder to the common bile duct. So it is the function of this spiral fold also. And this gallbladder is normally, it is to be said that is covered by the peritoneum, so it's considered as an intraperitoneal organ, and the function of the gallbladder is the concentration, be careful, concentration of the bile duct, so bile. So because the bile is produced in the liver, and is a storage, it happening inside the gallbladder. And here the water approximately, the water will be absorbed, and it's becoming highly concentrated here, and it's by the influence of the hormones, it's released by the cystic duct to the common bile duct, and it's going to the duodenum, the descending part of the duodenum. So whenever by the stomach the food which is contain a lot of fat tissue, it come to the duodenum, they are stimulating by the different hormones. For example, cholecystokinin, it's influencing in the release of the bile and helping for the digestion of the fat, and by enzyme of the lipase. If with any reason the passage of the bile from the gallbladder to the common bile duct, it's become disturbed, and this passage will not be happening, so it's happening the crystallization of the bile inside the gallbladder, and it leads to be a stone inside the gallbladder, which is the clinical terminology is called cholelithiasis, which is the stone inside the gallbladder. So here we are in dissection room, and I'm going to show you the liver, the macroscopical structure of the liver. So what you are looking at the diaphragmatic surface of the liver, and here you can see the part of this coronary ligaments that they are continue as a triangular ligament, and they are connected with the diaphragm. And here you can see the right lobe, and here you can see the left lobe. In here you can see some the impression in the right lobe, because we said that the right lobe is absolutely is covered by the costal cartilage. You can see some impression of the ribs here. And here is the left lobe, and in anterior side you see the falciform ligament, which is connecting the liver anteriorly with the anterior abdominal wall, and superiorly partly with the diaphragm also. And here it's another coronary artery in the left side that is continue to the triangular ligament, and here it's the appendix fibrosa of the liver, and it's connected with the diaphragm, and it's connected with the triangular ligament. And between the two coronary ligament, it's the area here which is called Bair area, which is not covered by the peritoneum and is covered directly by the diaphragm, so that's why they call it ara nuda or Bair area. From here you can see the inferior vena cava, which is going up there and is directed toward the right atrium, and here in diaphragmatic surface you can see the impression of the heart, which is the cardiac impression. And here it's the ligamentum teres hepatis, which is the round ligament of the liver, and is connecting is a remnant of the umbilical vein that is connecting the liver to the umbilicus. So if I turn the liver and look at the visceral surface of the liver, you can see again here is the right lobe here, and here is the left lobe, which is a smaller. Then you have the groove for the inferior vena cava, and here is the inferior vena cava, which is passed and is fixed by the ligament of the inferior vena cava. And left to this groove, so there is a lobe which is here, and it's called caudate lobe here. And here is the fossa for the location of the gallbladder, and it's located under this area which is called porta hepatis, I'm going to discuss. And here is the location of the fundus of the gallbladder, and left to that it's the another lobe of the liver, which is the quadrate lobe of the liver. And here is the ligamentum venosum, which is in the visceral surface, is continue, and it's continue as a ligamentum teres or round ligament of the liver in the inferior border. So here is the inferior margin of the liver, which is separating the diaphragmatic surface and the visceral surface. Here the structure that we said that it's porta hepatis. It's the structure that tree structure you can find. The most posterior structure is the portal vein, which is here. It's made or formed by the connection or junction of the splenic vein and the superior mesenteric vein, and then later the inferior mesenteric vein. It's joined to them in different variable position, either to the splenic vein or to the superior mesenteric vein, or at the junction of them, and they make the portal vein, which is the functional, responsible for the functional blood supply of the liver, and approximately 80% of the blood that it goes to the liver from the unpaired organ of the abdomen. It's contained a lot of nutrition. It goes to the liver, and as we said, then it's divided to the smaller venules that are called intralobular venules, or at the space which is called portobiliary space that we mentioned. Then in front of the portal vein, which is located posteriorly in the porta hepatis, and this tree structure, they are then continue to the hepatoduodenal ligament, which is the one of the ligament that they are making the lesser omentum. Anteriorly and to the left side is the proper hepatic artery, which is a branch of the common hepatic artery, which is arising from the celiac trunk, and this one also is responsible for the nutritive blood supply of the liver, which is approximately 20% of the blood that is going inside the liver, and is carrying the oxygen to the hepatocytes and the parenchyma of the liver. So this artery then later, as we mentioned it in the portobiliary space, is dividing to the smaller branches, which is the interlobular arterioles, and they are carrying the blood together with the portal vein, the branches of the portal vein, to the sinusoids that they are going then from the periphery to the central part of the classical lobules of the liver, to the central vein from the periphery to center. And then finally is this structure in front of the portal vein, and to the right side it's the common bile duct, and the common bile duct, as we mentioned, it is formed by the junction of the right and left hepatic duct, that they are carrying the bile from the biliferous interlobular duct, and they are joining together as a segmental ducts, and here is the right and left, hepatic duct that they join together, and they make the common hepatic duct. So it's anterior on the right side, and this common hepatic duct then later is joined with the cystic duct of the gallbladder, and they form the common bile duct that is open together with the pancreatic duct to the major duodenal papilla, and to the left side, and anteriorly it's the proper hepatic artery. So once more, the structure of the porta hepatis: posteriorly portal vein, anteriorly left side proper hepatic artery, anteriorly right side the common hepatic duct. So this is the structure. So concerning the impression that you can find here is in the left lobe, we said that there is an impression for stomach, the gastric impression, and unconstant for the esophageal impression. You can find it here in this area. There is an impression for the colic impression, the transverse colon and the right colic flexure. Here is the impression for the kidney and suprarenal gland, the right kidney and right suprarenal gland, and here is the area for the impression of the duodenum. Those are located in the right side of the liver, and here again the appendix fibrosa of the hepatis or the liver. So this is the visceral surface of the another preparation or another liver. For your orientation, here is the right lobe and here is the left lobe. Here is the inferior vena cava. Inside the groove of the inferior vena cava, next to that is the caudate lobe. Here is the gallbladder in situ that you can see. We said that the fundus of the gallbladder is going down and it will be projecting in the anterior abdominal wall at the point of Murphy, that is connecting the the mid-clavicular line on the right side with the ninth costal cartilage. Here is the Murphy's point, but normally the gallbladder is not palpable in normal size if it is not diseased. So here is the quadrate lobe next to the gallbladder. And what I wanted to show you here is also the structure that I already mentioned it. Here is the porta hepatis. So for gallbladder we said that here is the widest part, which is the fundus, which is here, and then there is a body, and then is followed by the neck. The transitional part of the body and neck is infundibulum. And from this neck region is this duct, which is called cystic duct. Cystic duct, if we open it, there is a spiral fold inside. As we mentioned, it is allowing to passage of the bile in both directions. And here, the cystic duct, as you see here, is connected with the common hepatic duct, and they are forming the bile duct or ductus choledochus. So the structure of in this case, the structure of the porta hepatis, as we said, the most posteriorly, it's the portal vein. Anterior and left side is the proper hepatic artery, and anterior and right side is the common hepatic duct, which is made or formed by the junction of the left and right hepatic duct. And this common hepatic duct is joined with the cystic duct, and they form the common bile duct, which is open together with the pancreatic duct to the major duodenal papilla or papilla of the Vater, and the sphincter of the Oddi is controlling the release of this structure. So next gland that we are going to talk, and it's belong to the gastrointestinal tract, is pancreas. Pancreas is an organ, is a gland which is mixed exocrine. It has exocrine secretion and endocrine secretion. So the most part of the pancreas is mainly exocrine part, that they are producing the pancreatic juice, or they call it succus pancreaticus. And only 1.5 till 2% of the pancreas is for the endocrine part, which is they have Langerhans island with the size of approximately 0.1 till 0.5 millimeter, and the number of this island, which is called Langerhans, it's approximately 1 till 2 million islands in this pancreas, and they are participating in 1.5 or till 2% of the volume of the pancreas. Pancreas, its secondary is located, and its organ as a secondary in retroperitoneal organ is considered, and the length of the pancreas is approximately 12 till 16 centimeter, and the weight is approximately 60 till 90 gram. The pancreas has three main parts. The part it's called caput or head. Then it continue, which is located in the right side, and then it continue as a body or corpus, which is directed toward the left side, and it's end up to the narrow place, which is called the cauda or tail of the pancreas, which is directed to the hilus of the left kidney. Regarding the body, the head or caput of the pancreas, we already mentioned that is located in the duodenal window, and it's projecting at the level of the body of the vertebra of the L2, and this is the characteristic place of the head of the pancreas. So in the posterior surface posterior surface of the head of the pancreas, it's very important. It's the place for formation of the portal vein. So the superior mesenteric vein and the splenic vein, they are joining together behind the head of the mandible, head of the pancreas, and it's forming the portal vein. At the posterior surface also of the head of the pancreas, the border between the head and the body of the mandible, there is a fissure that is a place for passage of the gastroduodenal artery, which is arising from the common hepatic artery that is coming from the celiac trunk in the posterior direction. And an anterior side and the inferior side of the body of the pancreas and the part of the head of the pancreas, so there is a place for the attachment of the mesocolon transversum. As we said, behind it's very important if you want to find the portal vein. So it's the formation of the portal vein, which is by the junction of the superior mesenteric vein and the splenic vein. It's behind the head of the pancreas. Another structure that you can find it behind the head of the pancreas is the renal vein. An artery of the renal artery, the blood supply of the kidney, also the last part of the splenic vein, and also behind the head of the pancreas. Also, you can find the inferior vena cava and the right cross of the crus of the diaphragm. So behind this structure, or this structure that we mentioned, that they are behind the head of the pancreas, it's separated by the membrane which is called retropancreatic membrane. So this vasa renalis, or the renal vessels, vena cava inferior and the right crus of the diaphragm, all of them, they are separated by the retropancreatic membrane. So between the head and the body of the pancreas, there is a place which is called pancreatic notch or incisura pancreatis, and from this notch it's passing the superior mesenteric artery and vein, and they are going over the horizontal part of the duodenum. The vein usually is located on the right side, and the superior mesenteric artery is located in the left side. And from this head of the pancreas, posteriorly, it's continue a process which is passing behind the superior mesenteric vessels, and this process is called the uncinate process. So then we have the body of the pancreas. The body of the pancreas it's directed toward the left side, and in anterior side you can find some ball-shaped prominence, which is called omental tubercle, which is the place that in front of the pancreas is attached to the posterior surface of the stomach. As you know that the stomach bed, the structure that is making the stomach bed is pancreas as well. And in this case, generally the pancreas, it has the anterior surface and the posterior surface, and in this case we have the superior border and or margin and inferior margin of the pancreas. At the superior margin of the pancreas and a little bit more posteriorly, there is a passage for the splenic vessels, or specifically the splenic artery. It's wavy shape and it's going toward the hilus of the spleen. So this is important, that whenever you want to find the splenic artery, it's in the superior margin of the pancreas is located. So the anterior surface of the head and the body of the pancreas is covered by the peritoneum, and it's continue as a mesocolon transversum. So ventrally, from the anterior surface of the pancreas, so there is a omental bursa or bursa omentalis that we already mentioned, and the posterior surface of the stomach. So posterior surface or posterior part of the pancreas, it's sitting on the head and the body, sitting on the portal vein, the splenic vein, or the vena lienalis, which is located more posteriorly, is sitting on the aorta and beginning of the superior mesenteric artery and the right crus of the diaphragm, and also the suprarenal vessels and renal vessels, and these vessels that they are going toward the kidney. So those are the posterior relationship of the pancreas. And finally, the tail of the pancreas or cauda of the pancreas, it's the narrowest part of the pancreas and is directed toward the hilus of the kidney, and also it's toward the spleen, and it's connected by the splenorenal ligament. So this part of the tail of the pancreas. Regarding the pancreatic duct, we have the one main duct of the pancreas as a pancreatic duct that, as we mentioned it, so it's connected with the common bile duct, and at the ampulla, which is called the hepatopancreatic ampulla, and they are opening to the major duodenal papilla that we already here, the major duodenal papilla that we already discussed. This major duodenal papilla, it's for the orientation and projection of the abdominal surface, the head of the pancreas and the greater duodenal papilla of the Vater is projected to the point of Desjardins point, they call it, and this Desjardins point is the point that is originated from the umbilicus toward the midpoint of the axilla. This line, if you connect this line from umbilicus to the midpoint of the axilla, from the umbilicus 6 till 7 centimeter is the place of the head of the pancreas and also the greater duodenal papilla, which is called Desjardins point. So this is. pancreas has another duct which is called accessory duct, and this accessory duct is open to the minor duodenal papilla, which is 2 centimeters above the major one, and it's called papilla Santorini, and it's the place for the opening of the accessory pancreatic duct. This pancreatic duct, of course, they are containing, or they are carrying the pancreatic juice, or succus pancreaticus, which is contained of a lot of enzyme for digestion of the food that is reaching to the duodenum. So, as I mentioned it before, when the acidic environment of the content of the stomach, it's going to the duodenum by the reflex and by the effect and influence of the hormone. The sphincter of the OD is releasing the bile and also is releasing the pancreatic juice, which is contained of lipase and peptidase and amylase. Those are the enzymes that they are important for the breaking down of this food and digestion of the food in this thing. So at the orifice of each duct, the bile duct and pancreatic duct, they are the sphincter, and these two sphincters, they can connect it together as a one sphincter, which is a sphincter of OD, or the sphincter of the hepatopancreatic ampulla. It's releasing. And the endocrine part that we said, that this is the exocrine part, that is 98% of the content of the pancreas is made or formed by this exocrine part. Only 2% or 1.5% of the pancreas contain the endocrine part, which is the Langerhans island that we mentioned, and that is producing a very important hormone, and they are containing of different cells, alpha cells that they are producing glucagon, the beta cells that they are producing insulin, the gamma cells that they are producing the polypeptide, and the delta cells that they are producing the somatostatin. Those are the hormones that you will learn in physiology. So those are. This is all about the pancreas and the relationship of the pancreas with the other organ. So here is the macroscopy of the pancreas. As we said, that the pancreas is the other gland of the gastrointestinal tract that is exocrine and endocrine. Both, mostly 98% is exocrine. They are producing the exocrine juice, which contain of the enzymes for the digestion, and the less part, around 1.5 till 2%, is Langerhans island, that they are endocrine. They are forming the endocrine part of the pancreas, which are producing the different hormone. The main and important one is glucagon and insulin. As we mentioned it in the theoretical part, the pancreas has the head of the pancreas, which is located in the duodenal window at the level of L2. So if here is the pyloric part of the stomach, and here is the superior bulb of the duodenum, and here is the descending part that is arising from the L1 till L3, then is going as a horizontal part of the duodenum, and then it's coming a little bit upward till the beginning of the L2 again. Here is the ascending part of the duodenum, and here is continue as a duodenojejunal flexure or junction as the other part of the small intestine. So between this C or U-shaped structure, here is the location of the head of the pancreas, which is exactly in front of the body of the L2 is located. Then following by the body, it's following by the head, it's the body, the body of the pancreas, and the junction between them is the narrowing incisura or notch, which is from here the superior mesenteric vessels is coming and are passing over the horizontal part of the duodenum. The vein, the superior mesenteric vein in the right side, and the superior mesenteric arteries in the left side. And also posterior to this vessel, it's this projection, the posterior projection of the pancreas, which is called uncinate process, which is from the head, it's directed behind the superior mesenteric vessels. And here it's the head of the pancreas that it has, as we mentioned it has anterior surface, posterior surface, superior margin and inferior margin, which is finally leads to the narrowest part, which is the tail of the pancreas, which is going and making some impression in the hilus of the left kidney, and it's going toward the spleen as well. At the superior margin and a little bit posteriorly, it passed the splenic artery and or splenic or lienalis artery here, and also on anterior surface, as we said, it's the place for the partly attached pathway of the mesocolon transversum, and in front of the pancreas there is a posterior surface of the stomach, as we mentioned it in the topographical anatomy. We said that the pancreas has two ducts. One is pancreatic duct, is the main one, the pancreatic duct, which in the next preparation I'm going to show. So here is the another preparation, and here is again for your orientation. Here is the superior bulb, here is the descending part of the duodenum, and here is the head of the pancreas. This is the uncinate process. Here is the body, and here is the tail of the pancreas. And if I turn the head of the pancreas, you can see the dissection of the pancreatic duct. This pancreatic duct is continue here, and it's open to this place, which is called hepatopancreatic ampulla, together with the opening of the common bile duct. This is the ductus choledochus or common bile duct that before we mentioned how it produced by junction of cystic duct and common hepatic duct. And usually they are separately, they are open to the descending part of the duodenum, and at the orifice of them they have the sphincter, one sphincter here at the bile duct and one sphincter here at the pancreatic duct. So they are controlling the release of the bile here, and here they are controlling the release of the pancreatic juice. And then inside, in the most of the case, they are joining together, and they make the sphincter, the common sphincter, which is called the sphincter of the Oddi. And finally, these two structures, the common bile duct and pancreatic duct, which is seen here, you can see it's open here to the, see, very nice here. It's the major duodenal papilla. Here I have it with my pincet here. At the longitudinal fold that is located in the posterior surface of the descending part of the duodenum. So it's open here, and approximately 2 centimeters above it's another opening, which is the minor duodenal papilla, which is open the accessory pancreatic duct. The accessory pancreatic duct also is at the level of the head of the pancreas. Also it's going cranially and is open to the minor duodenal papilla, or the papilla Santorini. So this is about the exocrine and endocrine. They are released the hormone insulin and glucagon to the blood circulation. So this is the sagittal section from the abdominal cavity to see the relationship of the organs with the peritoneal cavity. So this peritoneum, which is underlined by the red color, and the different organ and their relationship between the peritoneum and inside the peritoneal cavity. So generally, the peritoneal cavity inside the abdominal cavity is divided by the insertion of the mesocolon transversum, which is here, to the abdominal wall. It's dividing what is above the insertion of the mesocolon transversum. They call it supramesocolic part of the peritoneal cavity, and what is in front, it's the inframesocolic part of the peritoneal cavity. The supramesocolic part of the peritoneal cavity, you can find the main organ of the intraperitoneal organ, which are stomach, as you see, completely intraperitoneal organ. The liver, most of the part of the liver is intraperitoneally, except this area, which is called bare area or area nuda, that is directly covered by the adventitia and the diaphragm. And also the supramesocolic part also is containing all the biliary pathway, and also it's contained the upper part of the pancreas and superior part of the duodenum. Plus the spleen also is located inside the supramesocolic part of the peritoneal cavity. All these organs of the supramesocolic part of the peritoneal cavity is supplied by the branches of the celiac trunk, which is the branch from the abdominal aorta. The very basic structure that you can find it in the supramesocolic part of the abdominal cavity is the omental bursa, that we already mentioned it here. Here it's very nice. You can see the place of the omental bursa, and we can revise again the border of this omental bursa or bursa omentalis. So anteriorly the omental bursa, it's bordered by the stomach. This omental bursa is bordered by the stomach, and the peritoneum that it's covering it. So it means that it's the lesser omentum, which is here, and also the gastro-omental ligament, which is a part of the greater omentum. So the anterior border of the omental bursa is the stomach and lesser omentum, and the gastrocolic ligament, which is in this area, is making the part of the greater omentum. Posterior border of the omental bursa is the peritoneum, which is covering the retroperitoneal organ, and those retroperitoneal organ mainly is the duodenum, which is here, is located, and the pancreas, which is here. It's located, so it's located retroperitoneal or retroperitoneally. Also, it's covered the peritoneum. The retroperitoneal organ is the kidney. Also, is included this part, and also superiorly, this posterior border, it's reaching to the cardia of the stomach and the entrance of the esophagus. Then the superior border of the omental bursa is the visceral surface of the liver, and also in the left side, the part of the diaphragm. Also, it's making the superior border. The inferior border is the mesocolon transversum, the peritoneum, and the passage of the mesocolon transversum and the colon transversum, which is making the inferior border. In the left side, the spleen or lien is located and is bordering the omental bursa and the ligaments and the peritoneal that they are covering. So the spleen also is intraperitoneal organ. And finally, the right side is the epiploid foramen that we already mentioned it. In this section is not seen. This epiploid foramen or Winslow foramen, which is making the entrance to the bursa omentalis or omental bursa. We mentioned it is bordered anteriorly by the hepatoduodenal ligament. The posteriorly is bordered by the hepatorenal ligament, and inferiorly it's bordered by the duodeno-renal ligament. The omental bursa, as you see, it has two important recesses. One of the recesses, which is here, it's called the superior recess, and this superior recess, it's the very small and narrow recess cranially. It's going behind the liver and between the, as you see, behind the liver, and it's between the esophagus and vena cava inferior is located. So here is the superior recess. Then we have the inferior recess, which is unconstant. The inferior recess, as a matter of fact, it's between the two layers of the greater omentum, and it's unconstant. It's sometimes is not visible. We have another recess which is called the splenic recess or lienalis recess, which is the continuation of the bursa, omental bursa, toward the left side, in front of the pancreatic tail or tail of the pancreas to the hilus of the liver. So as you see here, for example, you can see the transverse colon that is covered by the peritoneum. It's just the mesocolon transversum. Those are the small intestines that they are intraperitoneally, and here is the mesenterium. The mesenterium or the mesentery that they are covering is a peritoneum that is covering the small intestine, the jejunum and ileum. They are inserting to the posterior abdominal wall as a root of the mesentery or mesenteric root. Root of the mesentery is starting and originated from the superiorly and left side at the duodenojejunal junction or flexure, and it's going directed toward the downward and toward the right side to the right colic flexure, and is approximately is 15 till 18 centimeter. So this is the root of the mesentery. Then, of course, here you can see the organ, the sigmoid colon, which is also is an intraperitoneal organ, and it's covered by the mesenterium or the peritoneum, which is called mesosigmoid. And finally, you can see here in this picture two pouch, because it's the female. The pouch between the rectum and uterus is called rectouterine pouch or excavation, the rectouterine excavation, or they call it Douglas or pouch of the Douglas. And here is the pouch between the uterus and urinary bladder, which is another pouch of the peritoneum in the lower part. So what is below this part is called infraperitoneal part, that they are located, for example, the urinary bladder, vagina, and so on, that we are going to discuss. So this pouch is very important clinically, because according to the gravitation, the exudation or inflammatory process or bleeding, it's accumulating here, and via the rectal examination, approximately in the right transverse fold of the rectum, you can touch this pouch, and it's very painful if there are some accumulation of the exudation here. So this is important cross-section through the peritoneal cavity. So dear student, that's all about the whole gastrointestinal tract and today's video about the liver and pancreas in this sunny Saturday day. Hopefully you will like this video, and I would like to thank my colleague Dr. Petrashek for his help, and I wish you have a nice weekend and study hard and stay safe. Thank you for your attention.